So you probably heard the recent news, right? A major health announcement about a very high-profile figure really got everyone talking, sparking tons of speculation. We're talking, yeah, about President Donald Trump's diagnosis with chronic venous insufficiency, or CVI. But here's the thing. What's maybe even more surprising isn't just what CVI is, but how incredibly common it turns out to be. I mean, figures suggest up to maybe 1 in 5 adults have it.
That's right. It's something many people might have and not even be fully aware of it.
Exactly. So why did this diagnosis, CVI, suddenly become such a huge point of public interest? Way beyond just a personal medical thing. And could a condition like CVI, which sounds maybe minor, actually be telling us something bigger about, say, overall heart health? We've gathered a whole stack of sources for this deep dive: official White House stuff, medical reports, expert opinions from news outlets, health sites.
It works.
Our mission today: cut through all that noise, pull out the really important bits, help you understand what this diagnosis really means, and explore the implications, not just for one person, but for how we think about health, transparency, and being in the public eye.
Sounds good. Let's dive in.
Okay, so the official announcement landed on July 17th, 2025. The White House confirmed President Trump has chronic venous insufficiency. And this was right after he'd apparently mentioned some mild leg swelling himself, something people online had already been noticing and talking about.
Yeah, there was definitely chatter, including observations about bruising on his hands, too, which added to the speculation.
Right. So in what seemed like a move toward being open about it, the White House press secretary, Caroline Leavitt, she gave this detailed statement, actually read directly from a letter from his doctor, Captain Sean Barbabella.
Yeah, that was clearly an effort to get ahead of the concerns, address the speculation head on.
Makes sense.
And it's just fascinating, isn't it, how the health of a president or any major world leader, it just instantly stops being purely personal. It becomes this broader public and political thing fast.
Absolutely.
The fact that they responded pretty quickly and, relatively transparently, which, let's be honest, isn't always the case in politics.
Sure.
It really shows they understand that his well-being or perceived well-being connects directly to public confidence, maybe even national stability. It's this unique mix, isn't it? Personal health, intense media focus, and how governments operate.
And his age, 79, definitely played into the level of interest, I imagine.
Oh, for sure. Age is always a factor when discussing the health of leaders. It just amplified everything.
So let's back up a bit. For listeners who aren't familiar, what exactly is chronic venous insufficiency? Can you break that down?
Sure. So, put simply, CVI is a long-term condition. It means the veins in your legs have trouble doing their main job, which is returning blood back up towards the heart. What happens is these tiny one-way valves inside the veins get weak or maybe damaged. And when those valves don't close properly, blood can kind of pool down in your legs, your lower extremities. That increases the pressure inside those veins.
That description makes it sound like it could be pretty common. You mentioned that earlier. Just how prevalent is it? And who's most likely to get it?
Yeah, you're right. It's surprisingly common. Figures vary a bit, but roughly 1 in 20 adults, maybe more like 10 to 30%, depending on the study.
Wow.
Vascular surgeons, they see this condition, well, all the time. And it definitely gets more common with age, especially, over 50 and certainly over 70, like in the president's case.
So age is a big factor.
Age is probably the primary factor, yeah. Those vein valves just naturally wear down over time, unfortunately. But lifestyle counts too. A lot.
Like what kind of lifestyle factor?
Things like standing or sitting for really long periods, that makes it harder for your calf muscles to do their job. That calf muscle pump, we call it. Those muscles squeeze the veins to help push blood upward. So being sedentary, not getting enough exercise, that contributes. And being overweight or obese adds extra strain on the leg veins too.
Makes sense.
Then there's medical history. If you've had a DVT before, that's a deep vein thrombosis, a blood clot that can really damage the valves permanently. Also, previous leg injuries, surgeries, something called phlebitis, which is vein inflammation. Even your genes can play a role. Or having valve defects from birth. Oh, and pregnancy too, actually. Hormonal changes and just the increased blood volume can affect vein function.
Okay, so a lot of potential contributors. If someone has CVI, what would they typically experience? What are the main symptoms?
The most common one, and what the president apparently noticed, is leg swelling, usually around the ankles. It tends to get worse as the day goes on, but then feels better if you put your legs up.
Right. Elevation helps.
Exactly. People also often report this feeling of heaviness in their legs or tiredness, aching, sometimes cramping, or even tingling, just general discomfort down there.
And are there things you might see? like changes to the skin or veins?
Yeah, definitely. Beyond just the feeling, you might notice skin changes. Itching is common. The skin might get dry and flaky. You can also see discoloration, sometimes a reddish brown or yellowish brown color, especially near the ankles. Over time, the skin can actually get hard and thick. That's called venous stasis dermatitis.
Okay.
And interestingly, sometimes an early sign can be those bulging, twisted veins we all know as varicose veins.
Ah, varicose veins. So they're related.
They can be. You can have varicose veins without CVI for sure, but if you have them and they're not managed, they can sometimes progress to CVI.
I see.
And if the CVI itself isn't managed well over time, it can lead to really serious complications. The main one is venous ulcers, painful, open sores, usually around the ankles. They're notoriously hard to heal and can get infected easily.
Oof, that sounds unpleasant.
Yeah.
Definitely something you'd want to catch before it gets to that point. How do doctors usually diagnose CVI?
Well, it usually starts with the basics. Talking about your symptoms, your medical history, doing a physical exam, looking at your legs. But the key diagnostic tool, the main one, is an ultrasound of the leg veins, often called a Doppler ultrasound.
Okay.
It's non-invasive, doesn't hurt. It basically uses sound waves to let the doctors visualize the blood flow and see if those valves are working correctly or if blood's flowing backward. And it's really important for ruling out other things too, especially DVT, the blood clot, which can have similar symptoms but needs urgent treatment.
Right.
They might also do some lab tests like a blood count, check kidney function, things like that, just to get a picture of your overall health and rule out other systemic causes for swelling. And sometimes, if they suspect a heart connection to the leg swelling, they might order an echocardiogram to check the heart itself.
Got it. Now, you mentioned this earlier, and it came up a lot in the sources, the term benign.
Mm.
The White House called CVI a benign vein condition. That sounds good, but does benign really tell the whole story?
That's a really, really important point. Yes, CVI is often labeled benign, primarily because it's generally not, immediately life-threatening. It's not like a heart attack or a stroke in that sense.
Right.
However, calling it benign can be a bit misleading because it really downplays the potential impact on someone's quality of life if it's not managed properly. The discomfort, the pain, the swelling, the limitations it can cause, and then the risk of the severe complications like ulcers. That's not insignificant.
Right. So benign doesn't mean trivial or ignorable.
Exactly. That distinction is crucial. It just means it probably won't kill you directly or quickly, but it absolutely needs attention and management to prevent problems and maintain quality of life.
Okay, let's pivot back specifically to President Trump's case. The official statement, as we said, called it benign and common among older adults.
Mm.
And this diagnosis followed a pretty thorough medical workup, right? Including those vascular studies and the Doppler ultrasounds on both legs.
Yes, and critically, the report stated they found no evidence of deep vein thrombosis, DVT, or arterial disease. That's huge, ruling those out. Lab tests were reportedly within normal limits, and that echocardiogram they did showed normal cardiac structure and function. So no signs of heart failure, kidney problems, or other major systemic illnesses causing the swelling,
Right.
which, is the kind of thorough check you'd expect for a head of state. They need to ensure fitness for the job.
And his doctor, Captain Barbabella, affirmed he remains in excellent health with good function across the board, cardiac, pulmonary, neurological, etc., and wasn't apparently feeling discomfort from the CVI itself at that time.
Correct. That was the official picture presented.
Now, what about those hand bruises that got so much attention? The official explanation was minor soft tissue irritation from frequent handshaking, plus the effects of taking aspirin.
Yeah, aspirin is commonly used for cardiovascular prevention, and it does thin the blood slightly, which can make bruising easier.
But that explanation wasn't universally accepted, was it?
No, there was definitely some skepticism voiced by outside medical experts. For example, one mentioned, Dr. Neil H. Patel, pointed out that just handshaking alone, even frequently, wouldn't typically cause that kind of bruising in his experience with business people. It just really underscores the level of scrutiny, doesn't it? Every little mark, every visible sign on a public figure, especially a president, gets analyzed and debated. It often requires a very carefully crafted official explanation.
Absolutely. So, stepping back from the specifics of that case, what do medical experts generally say about CVI?
Well, there's broad agreement that yes, it's very common, especially in people over 70 like President Trump. And generally, it is manageable. It exists on a real spectrum,
Mm,
from very mild, maybe just some spider veins or minor varicose veins, all the way to those severe skin changes and ulcers we talked about.
okay.
Most experts would classify it as typically not dangerous in the sense that it doesn't usually shorten your life expectancy on its own.
Right, but we keep coming back to this quality of life point. Even if it's not directly dangerous, it can make life pretty uncomfortable.
Precisely. The discomfort, the pain, the constant swelling that can significantly impact daily activities and just overall well-being. And it is a chronic condition. It tends to get worse over time if you don't manage it.
Like potentially leading to those ulcers maybe 10 or 15 years down the line, as one source mentioned.
Exactly. But the good news, and this is key, is that it's usually very manageable, especially if caught early and if the person sticks to the recommended conservative treatments.
Okay, so manageability is key. Now, here's something I found really fascinating in the research. The American Heart Association connection.
Ah, yes, that's a very interesting angle.
They highlighted a strong association between CVI and an increased risk for heart problems, cardiovascular disease, even mortality. And this was apparently independent of other known risk factors like age or sex.
That's right. It suggests that CVI might be more than just a leg problem. It could actually serve as a kind of sentinel sign,
A sentinel sign.
like a warning. Exactly. A warning signal potentially for underlying vulnerability in the entire vascular system. Finding CVI might prompt doctors to take a closer look at someone's overall cardiovascular risk profile, even if their heart tests seem okay initially.
Wow, that puts a different spin on it. So what seems like a localized issue in the legs might actually hint at something broader going on systemically.
Potentially, yes. It's an area of ongoing research, but the association seems quite strong, according to the AHA.
So even though President Trump's specific tests reportedly ruled out major heart issues at this time, did the external experts in our sources speculate about other potential factors that might contribute to CVI in someone like him?
They did. Even with the specific all clear, experts discussing the case generally would bring up the known risk factors that could be relevant for anyone in a similar situation. Things like body weight or obesity, age itself, the demands of a job involving a lot of travel or standing, maybe not having time for consistent, intensive cardiovascular exercise. There was even some speculation in some commentary, and this is just speculation about things like sleep apnea potentially playing a role as it can increase pressure in the heart and lungs, which might indirectly affect venous return from the legs. It
Interesting.
just reinforces the idea that you need a holistic view, doesn't it? Even for a condition often termed benign,
Yeah,
it's rarely just one isolated thing causing a health issue.
definitely. So, okay, if someone gets diagnosed with CVI, what's the typical plan? What are the main ways to manage it?
The first line of attack, and really the foundation of management, often for life, is what we call conservative therapies.
Meaning lifestyle changes and things like that.
Exactly. Lifestyle modifications are huge. Weight management if needed. Regular exercise is key. Walking is fantastic because it really activates that calf muscle pump we mentioned.
Right, squeezing the veins.
Yep. Avoiding standing or sitting still for too long is important. Taking breaks, moving around, and leg elevation, propping your legs up, ideally above heart level several times a day. That really helps reduce the swelling and pressure. And then a real cornerstone of treatment for many people is wearing compression stockings.
Ah, yes, the stocking.
These aren't just regular socks, they're medical grade garments, usually providing graduated pressure tighter at the ankle, looser higher up, typically around 20-30 millimilli Hg of pressure. They physically help squeeze the blood back up the leg and prevent pooling. Consistent daily use is often crucial for them to be effective.
That sounds like it requires some discipline.
It really does. The success of managing CVI with these conservative methods heavily depends on the patient sticking with it, making it part of their daily routine, which, can be challenging for anyone, maybe especially for someone with a very public, demanding schedule.
True. What if those conservative steps aren't enough? Or if the CVI is more advanced? Are there other options?
Yes, there are. Sometimes medications might be used, perhaps aspirin for blood flow or specific drugs if there are skin issues or ulcers, though diuretics generally aren't used for CVI swelling itself unless there's also heart failure involved.
Okay, and procedures.
There are several minimally invasive procedures that have become quite common. Things like endovenous laser ablation or radiofrequency ablation.
How do those work?
They basically use heat either from a laser or radiofrequency energy delivered through a small catheter inside the salty vein to close it off. The blood then naturally reroutes through healthier veins. Another option is sclerotherapy, where a chemical solution is injected into the vein to make it collapse and eventually fade away. Often used for smaller varicose or spider veins.
And surgery. Is that common?
Less common now with the minimally invasive options, but traditional surgical interventions are still used for severe cases, especially involving the large superficial veins. Things like vein ligation, tying off a vein, or vein stripping, which is removing longer segments of vein. It's worth noting, though, that treating problems in the deep veins is much more complex and generally carries higher risks.
Got it. Okay, so let's try to wrap this up. Key takeaways from our deep dive today. It seems CVI is really common, definitely linked to aging, and while maybe not immediately life-threatening, that benign label, it can seriously impact quality of life if not managed.
Absolutely. And President Trump's diagnosis really brought this common condition into the public spotlight, highlighting the importance of getting symptoms like leg swelling checked out with a proper medical evaluation.
Right. We've looked at the sources to understand what CVI is, the symptoms, how it's diagnosed, its impact, and that really important difference between calling something benign versus thinking it's okay to just ignore it.
And we also touched on that unique, intense scrutiny that surrounds the health of public figures.
Yeah. So for you listening, probably the most important message here is about awareness and management. Early diagnosis helps. And those lifestyle changes, exercise, elevation, managing weight, plus the consistent use of compression stockings if recommended. Those are really the foundation.
Or definitely. If you have persistent leg swelling, aching, heaviness, don't just brush it off. It's worth talking to your doctor about it.
So reflecting on all this, it's fascinating how a diagnosis like CVI, often seen as just a localized leg issue, might actually be, as you said, a sentinel sign for broader health concerns, particularly cardiovascular risk.
It really is. And how even small physical signs on someone in the public eye can ignite such a huge national conversation. It kind of makes you wonder, doesn't it? What other seemingly minor health signals, maybe in ourselves, maybe in society, might be whispering bigger stories? What clues might we be missing about our own well-being or even collective health trends?
That's a great question to leave people with. What stands out to you from this deep dive? Something to think about.